It's the crisis situation we have hoped to avoid since the beginning of this public health crisis. 10 Idaho hospitals are now operating under crisis standards of care. Crisis standards of care. For the first time in Idaho history, health care is being rationed based on a dire need because of a lack of resources. A severe shortage of staffing and available beds in the northern area of the state, according to the Department of Health and Welfare. Resources that have been consumed by caring for a massive increase of coronavirus patients. We came this close to this scenario last December, and we knew for the last couple of weeks we were teetering toward it again. Well, this morning it was announced we had fallen from that fulcrum. Not that hospitals hadn't done all they could to not be in this situation. Back on August 23rd and 24th, Kootenai Health installed a bigger oxygen tank there because the one they were using wasn't enough. And they converted the hospital's largest classroom into a place to put COVID patients, an overflow COVID unit for 22 patients not needing intensive care. That week, Kootenai Health said within a 36-hour period, 4 of their COVID patients died. Three of those 4 were under the age of 45. On Friday, Kootenai Health had 93 COVID-19 patients in the hospital. This morning, it was 108. 39 of which are in the ICU. Their website states 97% of their COVID patients are unvaccinated. So what does this crisis standards of care look like? We've laid this out before, but with today's news, it's worth another explanation. I've said this before as well, but for those of us of a certain age, we learned the term triage through the TV show MASH. Remember when Doctors Pierce and McIntyre or Major Houlihan would just walk onto a bus or through the stretchers that were lined up outside the surgical tent, and they would say, take that one, or he can wait, or he's not going to make it. And that's how they decided who got brought into the tent to get immediate medical attention. Idaho's crisis standards of care are kind of laid out the same way. First to get help would be those with immediate need, the red category, those with a life-threatening illness or injury where there's a chance their life can be saved, but something needs to be done quickly. Yellow, or delayed need, those who would be treated second, would have serious but not life-threatening issues, and waiting won't matter much to survival. Then there's minimal need, which is kind of self-explanatory. Minor injury or illness, you can walk in on your own kind of thing, but you would just have to sit there in pain while you wait for the third priority. The fourth category, and one which would have been higher in different circumstances, the expectant, or code black. That means you're in a bad way and not expected to survive what ails you, meaning they could try, but it would take too many resources and likely wouldn't have the desired outcome. In crisis standards, those folks are pushed to last, whereas in conventional care, that try would come much sooner. The State Department of Health and Welfare planned out these priorities last year when we were this close but never got there. But this is what is happening right now in North Idaho. In other words, if you break a wrist, the bones that are in your wrist, and you need surgery to fix it so it doesn't heal improperly, well, that's going to be tough. And while it may not be under the urgency of or the backdrop of war, like in MASH, nor is it because of a tragic natural disaster, this is still the state of care in 10 of Idaho's hospitals. Governor Little used this news today as a chance to address vaccinations once again. We have reached an unprecedented and unwanted point in the history of our state, he said. We've taken so many steps to avoid getting here, but yet again, we need to ask more Idahoans to choose to receive the COVID-19 vaccine. Right now, only 49% of eligible Idahoans have been fully vaccinated. And before you think, well, that's just up north, we're fine everywhere else, let's take a look at what it looks like statewide. The last week of August, the day the governor toured an ICU and saw all the COVID patients fighting for their lives, and he called it heartbreaking, the state website showed there were 72 ICU beds available. It dropped to 31 the next day. We bounced back towards 60 for a couple of days, but since September 2nd, in just 4 days, we have dropped to 11 available beds. 11 available beds in Idaho's intensive care units across the entire state. That's a drastic drop and a pretty low number, not as low as 4, which is the number Governor Little pointed to last week, while the state's website showed that 72. But because of that discrepancy, which a lot of you pointed out, the state changed the way it charted available beds. Instead of just open beds or including open pediatric ICU beds, Since September 3rd, they are tracking just beds that are available and able to be staffed. But the focus is on the Panhandle right now, where for the first time in Idaho history, care standards are in crisis mode. A declaration that covers 2 health districts, the Panhandle and North Central. And there are lots of questions as to how, why now, what's next, that Joe Paris will hopefully be able to answer for us. Joe, and I know major question right now is about the rest of the state, other regions other than North Idaho. How close to crisis are they?
Well, the short answer is that they're very close, but they're not in crisis standards of care outside of North Idaho right now. It's very important to note that this is just one section of the state, and that the Department of Health and Welfare and the medical communities, they're really able to do this tailored by region, and that's why we're seeing this. Now, activating crisis standards of care in other parts of the state, like the Treasure Valley, that was on the table in recent days when the State of Idaho Disaster Medical Advisory Committee met. Now, Health and Welfare Director Dave Jepson gave some insight a short time ago about the conversation he and the committee had about activating the crisis standards of care.
That it was appropriate for the North Idaho area, and it's a pretty serious thing to declare crisis standards of care. Something that none of us do lightly and take very seriously. And at the end of the day, we felt like we had just a little bit of wiggle room left in the rest of the state, but I want to emphasize not much.
So it's a bad situation right now, and the question, Brian, is how long do these crisis standards last? And long story short, this is not a 1-day or a 2-day thing. It's possible that we could jump in and out of it, but it's not likely. As Director Jepson highlighted this afternoon, this is really a major deal to trigger crisis standards of care. This is not a formality. This is not something that just happens once in a while. This is the last resort. This is pulling out all the stops for the medical system. It's a big deal. And Jepson and Dr. Robert Scoggins, who's the Chief of Staff of Kootenai Health up in North Idaho, they gave insight about navigating the crisis standards of care and really what the future could look like over the next few days and weeks in North Idaho, and in terms of where do we go from here and how does the crisis standards of care operate in terms of when are we going to be under them? Are we going to be out of them soon?
Yeah, could it go back and forth?
Could it go back and forth? Here's the insight they have on that question.
We will make that decision as it's warranted. And so if we get into a situation where it's clear we can go back to the usual standard of care, even if it's stressed, but we can go back to the usual standard of care, we'll do that. And then as the situation changes again, we would then relook at crisis standards of care. So we are going to watch the situation daily, monitor daily, and then make decisions as they're appropriate for the situation on the ground.
If it were to go away tomorrow, we would be out of crisis standards pretty quick, but I don't see that happening either.
Long story short, Brian, at least in North Idaho for now, we know it's going to be crisis standards of care for at least the short term, likely longer than that, depending on how many people are getting sick and having to get ICU care up north. Dr. Scoggins talked earlier that the percent positivity up in the community in North Idaho, it's very high. So they're expecting an influx of patients in the coming weeks.
So Dr. Scoggins with Kootenai Health right now, what is he seeing in his hospital?
Yeah, he's seeing some very terrible situations. They're seeing a situation where they're having to move into other areas just to give care to patients. They're moving into conference rooms, as we highlighted. They're now actually having patients in those conference rooms. At last check, they had 19 people on ventilators. When you hear that someone's on a ventilator, Brian, it's not like, okay, we'll try a ventilator. That's a last resort.
Right.
I'm sure a lot of our viewers and you have seen the situation that's created with the ventilator. They are forcing air down your throat in a very violent way, and that's because it has to be that way. There's also concern right now, Brian, about younger patients getting very sick with COVID, and that, along with everything else, is taking a major toll on frontline healthcare workers.
Those younger patients really do affect the staff quite a bit, and it's very traumatic to see young people that have many years of life left in them pass away. So, but the problem this time around is that it seems to be getting younger, and there is concerns as schools open here that we're going to see even younger patients.
And Brian, as we know, down here in the Treasure Valley in recent weeks, there's been major focus on schools and masks and COVID protocols. And I just think it's worth pointing out that on the health and welfare call today, you had several state healthcare leaders pointing to the fact that West Ada School District, who's the largest school district in the state of Idaho, they're recommending that Well, they are requiring masks, but you can opt out. And there's, as we reported, there's a lot of parents that have opted out their kids from the mask policy in West Ada. And it was highlighted again by several health experts from the state that these masks do work, these COVID protocols do work. Are they perfect? No. But they said that they're expecting to see more aggressive protocols in the coming days. They noted that West Ada had started the year where staff could opt out of the mask policy. Now, as we reported yesterday, you have to wear that mask. As a staff member, parents still have the option for now to opt out their kids of wearing a mask in the West Ada School District. But as we heard from the experts this afternoon, they would suggest having masks for all students to really cut down on the amount of virus that is transmitting.
The other thing they're asking people to do or not do anything crazy that would put them in the hospital. I mean, that might be an easier ask than wearing masks, but they're still asking people. This is the state that we're in right now, is that we're asking people to, let's just take it easy for a bit so you don't get hurt.
Yeah, obviously you can't control, for the most part, if you're going to be in a car accident. That's
Sure.
something that you're not planning to do. But they're asking people to be careful with extreme sports, with decision-making skills, with hikes, because right now, at any given moment, the ICU in our area or several other regions in our state could be overwhelmed. And if there's major car accidents, if there's a group of hikers that get gravely injured, that impacts the ICU. And they made it a point, health experts in the state made it a point today several times, be careful. We do not want to overwhelm the health system. And a large part of that, Brian, they're asking people, and I know we've said this 100 times, if you can get the vaccine, health experts say they are safe and effective, and they're our best tool to cut down against the spread of COVID.
Another thing that we both thought was interesting with this crisis standards of care, what it does is limit the liability of the hospitals, because that who gets served and how often or when people can get sued. Doctors can get sued if you're not giving enough attention to somebody, but if you can't do it because of the resources, well, that's what this crisis standards of care does. That makes it kind of about the money, which is going to start a whole other conversation. I understand that. Another conversation that's been happening right now is it's a staffing shortage issue. And as people are posting and asking us about this, has it anything to do with the vaccine requirements from our major health providers? Even Representative Brent Crane posting this. This is a direct result of primary health requiring their staff, he put this on Facebook, by the way, requiring their staff to take the COVID vaccine. Expect more news like this from St. Luke's and St. Al's. This is about Idaho's access to care and the staff not there to handle that. Well, I asked Representative Crane where his information came from, and he hasn't responded, didn't get back to me, other than just throwing something out there. But I called Dr. David Peterman with Primary Health to confirm this on a holy day for him, by the way. And he said, this isn't the case at all. In fact, it's shameful, he said, that people are using this vaccine requirement as a way to say, well, this is why we're having problems in our hospital. 91% of the 640 employees of Primary Health, Dr. Peterman told me, 91% of them are vaccinated, with about 8.5% that have gotten an exemption because of religious issues. 91%. And yes, he again also said vaccines and masks. So it's not about the vaccines, unless, of course, that's going to keep people out of the hospital.
Yeah. Again, they're encouraging everyone that can get the vaccine to go do it right away. We're in a crucial point here in the Treasure Valley, Brian. We need to take action now.
Thank you very much, Joe. All right, so